Hey guys, welcome back to the Minute Clinic. So with all the iNO that's being ordered on our patients, I thought we could take this moment to quickly go through how you would get iNO in line on your ventilator patient. So just a few reminders. Trevor makes these iNO vent kits, so everything that you need should be in this kit. We'll need our corrugated tubing piece, the little sample line adapter piece, two 15s, and then this 15 to 22 kind of cone adapter, and then your injector module, of course. Okay, so installing the injector module and sample line are quite easy as long as you know which adapters you need. And the other thing that you need to recognize is which side of the humidifier is the dry side. And really the easiest way to know is the shorter inspiratory tube. That's the one that's leading down into the humidifier. That would be your dry side. And the reason is that this is delivering gas into the humidifier, so it's not yet humidified or wet. And this side, where the humidified gas is coming out, would be considered your wet side. So your injector module needs to be installed in this dry side. First thing, I'm going to grab my injector module. But what you're going to notice is it has this arrow. This arrow is incredibly important because if you don't put this arrow in the right direction, you will not be able to deliver the appropriate dose to your patient. So the arrow needs to go in the direction of the flow of your gas. So since our gas is coming from the vent down into the humidifier, I want to make sure that my arrow is pointing down. So what you need is your little cone adapter will be placed here on the dry side. Now I can place my injector module using that adapter. Next comes your 15, which I now can take my inspiratory side, that first shorter limb, and install it right on top. And now as you can see, the gas is coming from the vent, following my inspiratory line, and then going down, which is where the arrow is going, pointing down into the humidifier. So if this arrow was pointing upwards, that's going the opposite direction of the gas, and that would be incorrect. Next, I'm going to take my corrugated tubing piece, and I'm going to put your sample line adapter and connect it to one side of the corrugated tubing. And then to the other side of that sample line, I'm going to take my 15, connect here. This all can now be connected into the inspiratory side of my circuit. So that would connect here. And now the whole thing looks like this. And this end is now the end that will go directly into the Y. Okay, so looking at closest to your patient and where it's connected at the Y, this is what the final product should look like. You have your corrugated tubing extension here that's connected at the Y. Here's your sample line. And now your patient is ready to go and it can deliver nitric accurately as long as you have your injector module facing the right way. So arrow down, which is with the flow of gas. Another question I've been getting is many of our patients are on aerogen treatments. And usually the aerogen also would be placed here on the dry side. Well, if I put an aerogen adapter here, it's going to raise the height of this so tall that you end up running into an issue where you just don't have real estate to fit it, or it makes it really hard to work with. So what I would recommend is if you have an aerogen treatment, just go ahead and put it on the opposite side of the humidifier. Even though that's the wet side, it's not the preferred spot. It will still deliver medication, but it will at least allow it so you don't have so much height when all of this is connected on one side.